One more thing which is very common and it's confusing and presents as a differential diagnosis for arthritis of the base of the thumb is dequervens tenosynovitis, which is inflammation along the first extensor compartment tendons. The pain is usually around the radial styloid, and patients can complain of base of thumb pain, and it's confusing. So in base of thumb arthritis, as we know, pain is usually around the CMC joint and the grind test is positive. Whereas let's look at dequervens tenosynovitis. In this test, when we look, we notice some swelling around the first extensor compartment tendons. These are the tendons which extend the thumb. Swelling can be noticed and going up the forearm as well. Patients typically complain of pain when they are picking up things. A test to do and confirm dequervens, first of all, is palpation around the first extensor compartment. And patients will typically have pain over the radial styloid and the radius rather than on the base of the thumb. The second test, which is called the Finkelstein's test, is also very nice. And what we do is we radially deviate the wrist and then I pull the thumb down. And as I pull the thumb down, patient experiences sharp pain going along the first extensor compartment up to the forearm and down to the thumb. And that will confirm your diagnosis. If the patient is very uncomfortable, we can ask them to do the test themselves rather than pulling their thumb down. So we can ask them to bring their thumb down and they will experience pain and discomfort. Some people like to include the thumb in the fingers. That is not how the initial test was described. And that can also be done. But I usually find it easier just to bring the thumb down and notice any discomfort or pain along the first extensor compartment. So that's a differential of base of thumb arthritis, which is dequervens tenosynovitis and first extensor compartment inflammation.